Thanks for coming out to the Triad of Health video series. Our videos are, pretty good. Sometimes I get a little long-winded and I'm trying to edit them down, but if you want to offer to help me edit these videos, please just call in and let us know. We'll pay you, I guess. We just, want to pay you something that's reasonable. We do need some help. So let's go talk about sugar a little bit. There's so many books about sugar. Lick the Sugar Habit, Sweet Deception, the Sugar Control Bible is good, by Janet Paltrow. I think Janet is her first name, but it's Paltrow is her last name, I think. Anyway, it's definitely called the Sugar Control Bible. There's just, you just have to go to the bookstore and check it out, I think. Sugar Blues is a good book about sugar. So check these books out. Now, what is it about sugar? Okay, so there's so much misinformation about sugar. It is just nutty. I hope you like my special sweaty attire here for you. There's not a lot of sugar here, just a little sugar. There's 15 to 20% sugar in grass, grains, cereal, or not grains, but cereal grasses, and things like lettuce and Swiss chard and cilantro and bok choy and arugula and kale. Those things do have sugar. Okay, those are complex carbs, believe it or not. So you're eating complex carbs if you eat those things, and those things are healthy usually if you cook them a little bit. So the thing about those vegetables is they have 15% sugar on the glycemic index, but that's not a problem. That's a low glycemic index, which is good. Too much sugar, too much disease. Sugar ages the body. So sugar causes something in your bloodstream to go up called AGEs. Advanced Glycosylated End products. Okay? So the AGEs cause aging. Sugar causes cortisol levels to rise in order to break down the sugar. Cortisol and insulin goes up. Glucagon goes down, okay? And now we have a lot of sugar in the blood, okay? Because it's trying to break down the sugar that's in the blood, but it can't because it's too much is in your diet. Now what happens is, because the cortisol levels have gone up, it'll interfere with the conversion of T4, which is inactive thyroid hormone, to T3. Now you're in trouble, okay? Now you're ending up with thyroid stress. So you're ending up getting cold all the time. You get cold hands and feet. You sweat more than you should, especially women. And women are not supposed to sweat as much as men, right? You know that. Men and women don't perspire equally. Men should be sweating a lot more than women. And if they're not, the woman's got an imbalance, of course. Like the imbalance caused by the thyroid condition known as hot flashes and night sweats. Thyroid regulates body temperature. So that sugar that interfered with the conversion of T4 to T3, that's a big problem. There's mosquitoes out here. Maybe this wasn't the perfect place to do the video, but so sugar's like a drug. It stimulates the brain in such a way that you become addicted to it. So the more sugar you have, the more sugar you crave, and you get into that cycle. Sugar is just nasty stuff, man. It's like cocaine. It's one molecule different than cocaine. So a lot of, not a lot of, but when you have sugar, it's kind of like you're just trying to think of how to describe this. Sugar is really important for brain function. So it's not like evil to have sugar in your blood. You need sugar for health. You'll die without it. The way that you make epinephrine and norepinephrine is from metabolizing sugar, believe it or not. Glycogen is released from the liver, which is sugar chains of sugar stuck together, glucose and glucose stuck together, and then it's broken down just into glucose, or a simple disaccharide, and then you can use that as the raw fuel needed to make epinephrine and norepinephrine. So that's fine. It's just if you have large amounts of sugar, then that interferes with brain function. You end up having an imbalance between something called oxidation and reduction biochemical pathways in your body. So that's not good. It's kind of complicated. I don't want to get into it, but it's not good. So it's so not good that you end up burning sugar instead of fat, which means you lose lean muscle mass and you end up with aches and pains all over your body. You end up with high cortisol levels, puts fat all over in this region here, this whole upper part of your body, which you don't want because it doesn't look nice, I guess. But it's not just that it doesn't look nice, it's really unhealthy. We're talking about adrenal gland disease. Okay, so that's kind of an introduction to the problems with sugar. Sugar is a big issue now in America. Sugar leads to too much sugar leads to diabetes and stuff like that, as you know, diabetes type 2. Okay, it leads to a lot of problems. It can lead to dementia, heart disease, thyroid disease. The list goes on and on and on. A lot of these people with pancreatic cancers, they just had too much sugar for too long. Nobody told them that the rice they were eating was sugar. Nobody told them that the oatmeal they ate was sugar. Nobody told them or explained to them for whatever reason, or they didn't understand that bread is sugar. Nobody communicated to them that their little fruit jamba juice thing, fresh juice that they have, is sugar. Even the vegetable ones have quite a bit of sugar, and they're not so healthy either. So, sorry to break the bad news to you. I'm not like I want to be a bearer of good news, not bad news, but at least you're getting the important facts here. Okay, we'll see you on the next video.